When you're dealing with the most advanced heart disease, waiting for a transplant can feel like an impossible journey. But what if that wait could actually be productive? What if, instead of getting weaker, patients could get stronger? Today, we're looking at a huge medical breakthrough that's doing just that. It's completely changing the game for some of the sickest people out there.
So, first things first, we really need to understand the stakes here. We're talking about a very specific group of patients. These are people with end-stage heart failure, but it's also complicated by something called pulmonary hypertension. That's just a way of saying the blood pressure in their lungs is dangerously high. For these folks, the clock is always ticking, and honestly, the outlook has always been pretty grim. If you leave this condition untreated, this is what you're looking at: less than 5 years. It's a really stark number, and it just hammers home how urgently we've needed a better way to keep these patients stable and strong enough to even get to the transplant that could save their lives.
For a long time, the main tool in the toolbox was a device called a durable left ventricular assist device, or you'll hear it called an LVAD. It's a pump, and it's surgically implanted to take over the work of the failing heart. But this so-called permanent fix, it comes with some really serious problems. Yeah, these durable LVADs can cause some really scary, life-threatening complications. We're talking infections, stroke, serious bleeding. And here's the real kicker. Sometimes, the device itself can make a patient ineligible for a transplant down the road. With waitlists for hearts getting longer and longer, it's just not the ideal way to bridge that gap.
So clearly, we needed a better bridge, a smarter way to get from A to B. And that is exactly where this new technology comes into the picture. Researchers and doctors over at the Mayo Clinic have started using a device called the Impella 5.5. And believe me, it is completely changing how patients wait for a new heart.
So what is this thing exactly? Well, the Impella 5.5 is this tiny but incredibly powerful pump. But it's different from the old LVADs in two huge ways. First, it's temporary. It's not meant to be in there forever. And second, look at where it's placed, through the axillary artery right up under the collarbone. Now that is a huge deal. It's so much less invasive than cracking open a chest for open heart surgery. That means a faster recovery, and this is the critical part we're about to get to, it lets the patient move around. And the difference this makes for the patient is, well, it's night and day, seriously. Instead of being stuck in a hospital bed just passively waiting for the phone to ring, these patients are up. They're walking around the ICU. They're actually participating in physical therapy. The pump keeps their blood flowing optimally, which means all their other organs stay healthier, making them way better candidates for surgery when the time comes. It's a complete flip of the script on the whole waiting experience.
Okay, so patients feel better while they're waiting. That's amazing. But what about the ultimate outcome? Does this new approach actually lead to better survival after the transplant? Well, the answer is a resounding yes, and the numbers are nothing short of incredible.
95%. Let that sink in for a second. That is the 1-year survival rate for patients who were bridged to their new heart using the Impella 5.5 pump. It's just a phenomenal number, and it proves just how effective this strategy really is.
And hey, this isn't just some theoretical number. That 95% comes from a 2023 study looking at 38 real patients, all over 50 years old. The average age was 63. The majority had what's called ischemic cardiomyopathy. Basically, their heart muscle was weak because it wasn't getting enough blood. In the past, patients this old and this sick might have been turned down for a transplant, but this little pump supported them for about 27 days on average, getting them to that life-saving surgery in much better shape.
But you know what? The story doesn't even end there. While the researchers were so focused on fixing these patients' hearts, they stumbled onto something amazing, a totally unexpected bonus benefit that was, in its own way, just as life-changing. You see, really bad heart failure often causes really bad kidney failure. It's a nasty combo called cardiorenal syndrome. A lot of these patients weren't just on the list for a heart, they were on the list for a heart and a kidney. So the big question was, what was happening to their kidneys while this tiny pump was busy helping their heart?
Well, according to Dr. Rohan Goswami, who was one of the lead authors on the study, the improved blood flow from the pump wasn't just good for the heart, it was giving the kidneys a chance to heal, showing a real, sustained improvement in their function.
Let's just walk through this because it is truly incredible. So step 1, a patient is on the list for 2 major organ transplants. Step 2, they get the Impella pump. Step 3, that pump improves blood flow all over the body and their own kidneys start to heal and work properly again. And the result, step 4, they get taken off the kidney transplant list. They now only need a new heart. I mean, that is a massive development.
All of this naturally leads to an even bigger, more exciting question. If this temporary pump can help kidneys recover, what about the organ it was designed for in the first place? What about the heart itself?
Just like Dr. Goswami says, getting patients in the best possible shape is key. But the holy grail here, the ultimate goal of this research, is to get a patient's own heart so healthy that it can recover. The dream is that for some people, the Impella 5.5 isn't just a bridge to a transplant, but a bridge to their own full recovery, letting them avoid a transplant completely.
And that's the powerful idea this research leaves us with, right? We're watching medicine shift from just trying to keep patients alive while they wait to actively making them stronger, and in some cases, even healing their other organs. It just opens up this incredible possibility that for some people, the best new heart might just be the one they already have.